So this is a typical gathering of one of our centers in Liberia. The premise of microfinance is that we take the bank to the village instead of asking people to come to us. We have no collateral needed. We just need a business plan, an idea, and some determination, and then the members of each of these quote-unquote banks help and support each other. We've serviced more than 50,000 different women in Liberia and worked in 14 out of the 15 counties there. It's just been, this is the first program that we actually launched and operate ourselves. Up until the time we came to Liberia, we've been partnering with and helping other entities, but this was the first time Foundation for Women actually launched a program. Next slide, please. And the reason we're doing it is for many reasons, but this is my namesake Deborah on the right and her sister Florence on the left, who I picked up off the street about 6 years ago after she was abandoned by her parents. And I just so believe that we have an obligation to create a different world and a better future for Deborah and Florence and all the children of the world. Next slide, please. So this is one of my favorite Rotarians. This is Dr. Joseph Bokai. He was the former vice president of the country of Liberia. And he has this framed photo on his office wall. It's amazing what can happen when nobody cares who gets the credit. He's been a dear, dear friend to both Angela and I for many, many years, and is our chief promoter of all of the work that we do in Liberia. And Rotary has been the glue that's really held all of this work together. When I first landed in Liberia, I went to meet him because, for many reasons, and I was there about an hour and said, I have to leave now, sir, because I'm going to make a presentation in front of the Monrovia Rotary Club. And he said, are you a Rotarian? And I said, yes, for many years. And he said, that's my club. But now that I'm vice president, I don't get to go very often, but if you're going to make a presentation, I will come and introduce you. And he did. And we have just been best friends ever since. It's amazing, the connections. Rhonda, I know you're shaking your head. You know what can happen when you connect with other people that have this same commitment to Rotary. So next slide, please. So I am very, very blessed and honored to introduce you to my really dearest sister, Dr. Angela Benson. We're just sisters that are coming from different mothers, but we met during the Ebola crisis and we've been inseparable ever since. And we work together now because not only does Foundation for Women fund individual people, but 7 years ago we started funding low-fee independent schools. We've got 350 school partners that we've helped financially. And a couple of years ago we started funding independent health clinics, and with just the greatest joy to work with Angela and her husband, Dr. Jimmy Benson, who operate Benson Hospital in Monrovia. So our current focus in our work right now, because of this pandemic, is food security in the country. There are hundreds and thousands of families that have no food right now. And we started a campaign about 6 weeks ago, and we've been able to help hundreds of families so far in many health clinics. But I'll turn it over to Angela now so she can tell you a little bit more about her country, and then we'll be glad to answer any questions you might have when we're finished. So Angela, to you.
Thank you, Deborah. And thanks to all of you wonderful Rotarians. We're happy to be here. As I said, my name is Angela Benson. I'm a physician with International Public Health specialization, and I've worked in several organizations before, like UNICEF, WHO, and of course in Liberia with the government, Ministry of Health, and also with national institutions for training doctors. So because of Ebola, Liberia has been through a lot of challenges. Small country in West Africa, it has been through a lot. Next slide, please. I just wanted to show you the map. I will be talking on the introduction to the whole talk and the Liberian economic as well as the nutritional status and the opportunities all of us as Rotarians to help people, because Rotary is service above self and is helping to make the world a better place. Then we have this partnership between the Benson Hospital and Foundation for Women. As you've heard from Deborah, we've had that connection to help other independent small clinics, and they are being helped to be able to be empowered to provide quality care. Then we'll talk a little bit about partnership and then the conclusions. Next slide, please. So Liberia is a small country in West Africa. It's bordered by Sierra Leone on the east, Guinea in the north, and Ivory Coast on the east. Then you have the whole south bordered by the Atlantic Ocean. So you can be driving and you are looking at the beach throughout Monrovia. The population of the country is only 5 million. So it's actually very small. And we hope that a lot of impact can be made with some dedicated funding. Liberia has 15 counties. These counties are sort of managed like mini states. And the country was engulfed with civil war in 1989. That lasted for about 14 years. Up and down, up and down. And in that period, we lost 250,000 people in a country that's so small. There was massive destruction of the infrastructure, massive destruction of everything. All of the sectors were involved. Of course, the health facilities, hospitals were completely looted and destroyed. So the government tried to revitalize the health system and build back as much as possible. But then as we were rehabilitating and coming up to reconstruct, then we had Ebola virus epidemic. That happened in 2014 and lasted for a whole year, leaving another 5,000 people dead and 200 of them health workers. And that is the map of Liberia down there. It's in West Africa. You know, the country already have very limited health workers. So 200 of them gone with Ebola epidemic is a lot. Next slide, please. So what is the economic situation and the nutritional status in the country? I'm bringing this out because we want to focus our attention on the nutritional aspects and to be able to see how we can help. Liberia is one of the poorest countries, least developed countries in the world. About 80% of the population actually live below the poverty line. That is living on $1.25 a day. And 94% of the workers who are working are also very poor because they are living below $2 a day, because they have to take care of the extended family, not only their one mouth, but extended families. The GDP ranked Liberia out of the UNDP, United Nations Development Program. They rank the countries of the world up and within the, in terms of their economic status. And Liberia is ranking 178 out of 190 countries in the world. So we are almost down, almost close to the bottom ladder. In Human Development Index, there was some improvement in Liberia from the 2000 to 2004, 5, all to 2007, because we were having a new president and there was some debt cancellation. So that resulted in about 2% increase of the GDP. But that didn't last long before it started to decrease again until 0.38. The exports that were in the country that could generate funding things like rubber, timber, iron ore, diamond, we get cocoa and coffee. So you get all of these natural resources and crops that could bring money. Women of reproductive age group, about 37% of them are anemic. So if they're anemic and they are getting pregnant, you know that their children will also be anemic. And so that already starting them off on a very poor footing. Children under the 5 years of age have chronic malnutrition, that is stunting, and that is 39%. So we can say almost one out of every 2 children are stunted. And malnutrition contributes to 45% of death among children under 5. You can imagine children dying, and most of the causes that are attributed to other infectious diseases are also caused by malnutrition. And severe malnutrition stages among children 5 years, under 5 years of age is up to 6%. The causes of this malnutrition is because there are actually too little food in each of the food category. Be it carbohydrate, protein, vitamins, minerals, you name it, they are in short supply. And you also have a shortage of clean water that resulting in diarrhea. And because of that repeated diarrhea, the children tend to become malnourished, and some of them go on to become stunted. Next slide, please. Next slide. What are the opportunities that we as Rotarians can harness and bring together? As you have seen, the need is so huge. We cannot meet all of the needs in one go, but at least we can start somewhere. And that is why the partnership between Benson Hospital and Foundation for Women is so unique and special, starting to address some of these needs. We know that the areas that we can look at are women's health, children's health, and even the teenagers. We partner in the area of school health, and that is having the captivated audience, the school children going to school. If they do need help, then they are able to have access to essential medicine and medical care and primary health care, as well as lab tests. We also partner at the level of Benson Hospital, which is a secondary facility in Monrovia in the Pittsville area. When the 50 community clinics that are supported by Foundation for Women are giving loan, and these loans are based on their needs. They assess need, whether they want to improve their laptop, they want to improve medicine, they want to improve the infrastructure, whatever they want to improve, they write small mini proposals to Foundation for Women, and Foundation for Women assess them, and then based on their intake and what they are able to generate, they do give them the loans. So we have 50 clinics in that category. These community clinics cater to primary health care. They are like your primary physicians here, and they work with household children. We also can monitor whatever is given to them because we have accurate record keeping, and we can follow up with health education on nutrition for women and children. Next slide, please. So the Benson Hospital with Foundation for Women had been on this partnership for about 2 years. Foundation for Women has a track record of doing excellent work with its pillars of microfinance, because they've covered 14 out of 15 counties in the country. And that is the microfinance pillar of Foundation for Women. Then, as you heard from Deborah, we also have the education pillar, and they cater also to schools. But for us, for the partnership with Benson Hospital, we cater to the health pillar. And the health pillar is one of the newest pillar with Foundation for Women, and that is to really take care of these 50 vulnerable independent community clinics. And we hope to increase as we go on into the year and next year. And Foundation for Women has been providing these loans, and we have seen quite a significant improvement in the quality of care for these community clinics. Benson Hospital also has a track record of providing quality health care to the vulnerable communities in the suburb of Monrovia, called Pinsville, and throughout the surrounding villages. If the loan can help the schools improve their enrollment, I certainly think that yes, it can also help the clinics to provide better health care to their catchment population. And when this initiative or partnership started 2 years ago, we had all of the various challenges, but these 50 clinics, which are independent community clinics, were able to show results, and they have been improving significantly. It's just now that we have the COVID that things have slowed down, but we hope that going forward, we'll be able to have more of these clinics having access to more loans. Meanwhile, we want to emphasize the need for the food. That is what we are focusing on during the COVID months. So Foundation for Women provide loans to community clinics to strengthen these clinics' lab, or to strengthen their medical supplies, or to improve infrastructure, as I said. And if they do have any needs that patients that have problems that they cannot take care of, they can refer to Benson Hospital with more expertise to take care of those patients. Next slide, please. Also with partnership, we want to partner with the Rotary clubs, like your 17E clubs. We want to provide ready, available funds to get food into the table of these kids and the women, because right now they just do not have access because of the pandemic. And we also know that the vulnerable community members are among the 50,000 people that we cater to on a regular basis, on a daily basis. With the past experience and good track record that Foundation for Women has, we know that we'll be able to follow up whatever is being given to these women and children. We will also be able to report back on the implementation of whatever food is given to them. Usually, one bag of rice lasts them for 1 month, and sometimes the household can be up to 10 children living in the house, or 9 or 8 children living with the mother or the 2 parents. Already we have a system in place whereby these clinics organize themselves into a network of excellence. And this network of excellence is using indicators that the Ministry of Health has, and to be able to say, assess themselves, and we check them. What are the indicators they are using, and how are they monitoring what they are doing on a monthly basis? They have meetings and they bring up their challenges. We advise them, guide them what to do as they move on each month. So depending on the availability of funding, we can go to scale in each of the county, the 15 counties that we have in Liberia. And as I said, we can make a lot of impact, because we're starting from Monrovia alone. It has 1/3 of the national population. So you can begin by making an impact, and you can spread forward depending on the resources. Next. So in conclusion, we know that a child is being born to the world every day. And we know that this child has blood and bones and systems that are growing. He or she cannot wait. Now is the time for action. No matter where that child is growing, that child cannot wait because they need help. The provision of food to a woman is like feeding a total of 10 people in a household. Sometimes one household even have more than 10 people in Liberia. So it is a possibility. It's a new day for families in Liberia to move from poverty into healthier life so that they'll be able to live, to work, and to develop themselves. Thank you for your attention. The last slide. The last slide is to show you a lady who is an Ebola survivor. Jenna is an Ebola survivor. She lost her husband, her mother, her sisters, and brothers in the Ebola, but she was the only survivor in her family. And because she had lost all of these relatives, the children from the mother, from the sisters and the brothers are now her responsibility. And you can imagine this household has more than 10 children, has almost 15 to 18 children that she has to take care of, nephews, nieces, and the children from her own self, from her own children. So that is the problem sometimes that is faced with in Liberia. So whatever you do, your ideas, your contributions are all very appreciated. Thank you for your attention. Any questions?
Let me just add one thing. When we started this food security campaign for Liberia, we understand that food is an issue for everybody. The food lines in America are tremendous now. I mean, this is a global issue. But the reason Angela and I are so determined about this effort is that because the country is only 5 million people, we've impacted so greatly the country already. We are trusted entities. Just like during Ebola, we had a big buckets and bleach campaign so we could get sanitary supplies to help keep people safe during Ebola. Now we want to get food into families' hands because people are starving. They're just starving. And so our campaign was for $25. We can get rice and give people small money to buy supplies to feed a family for a month. And there's just, I don't know any place else right now where $25 can feed a family for a month. So thank you for listening to our story. We would love some support and referrals to anybody else who might be interested in hearing about this. And Liberia has a very unique history with America. It's the only country on the African continent that was not colonized by European countries. It was actually colonized by slaves returning from America. Their flag looks like ours, except for it has 1 star instead of 50, and they have the same 3 equal branches of government. Everything in Liberia is patterned after America, and they really think they're the 51st state of America. And when things happen like Ebola, like COVID now, they really look to America to be there for them. So I just go back to that very first slide I showed you where I really believe that we're one human family and we're all in this together. We've got to hang on to each other and we've got to help each other. So thank you for inviting us, and thank you for letting us share our story with you all.
Thank you so much, both of you, for that outstanding presentation. Are there any questions?
Deborah and Angela, this is Kathy. I just really wanted to thank you both for sharing tonight. Is there a place that we can donate to?
Yes, yeah, our website is foundationforwomen.org. And we're a 501c3 charity based in America for more than 20 years. So every deduction, every donation is tax deductible, of course. So that way, or if your club wanted to work with Tracy's club, we're trying to get some things going on in your district to maybe do some partnering with my district here, or perhaps with Angela's club in Liberia. So I invite the conversation between you all and Tracy to see if we can do something bigger at a district level. there's several ways. So there's personally, yes, foundationforwomen.org. There's club ways, partnership. There's district possibilities. So we're just very determined to, I was on the phone with several people in Liberia today, and I have this friend, Evelyn. She doesn't know how old she is. She doesn't know when her birthday is. She had a stroke several years ago. She has no family. She lives alone, and she has no food. And so I made sure that someone got a bag of rice to her today, but there are just too many stories like that in Liberia. And we just have to help. We just have to help.
Sad. Yeah. Yeah, we really do have to do something. Does anybody else have a question?
This is Rhonda. Thank you again, Angela and Deborah, for your presentation. I am interested in microfinance. I'd like to understand more about the programming that you have and how the people being so poor, how are they able to pay back? What type of programming do you do? And if you're extending beyond Liberia, or are you just now focused in Liberia? What are your goals?
Well, it's a great question. And, you know, if you go to our website, foundationforwomen.org, it really is a good explanation of all of the pillars. The only one that is not there now is we have a new microfinance partnership with Habitat for Humanity that we're starting next month. So we're going to be able to give funding to families for enhancing their home realities. But basically, the whole premise of microfinance is that it's a hand up instead of a handout. We stand next to people and we give them access to capital, just like if you were going to start a business and went to a bank and said, I needed X amount of capital to get this business going, and the bank became your financial partner. We become their financial partner, their business educator, their cheerleader. And the first loans that people take from us are usually about $150 US equivalent. And it's over a 1 year period. They have 1 month of no payment so that they can invest the capital in whatever they're doing. And many of them do very small things. Like many people in Liberia make their income from very small markets. So people don't have refrigerators, and they don't have, they cook on gas stoves outside, you know, so they need to go to the market every single day. So people buy money to sell charcoal, to sell peppers, to sell fish, to sell all kind of food supplies, and the more that they can have access to capital, they can buy from the wholesaler rather than buying from the equivalent money lender person. So and once they have done one loan cycle with us successfully, they're just part of our family forever. They get access to more capital and more capital and more capital. Some women have been with us since we started the program in 2006. So it's I take a peek at the website whenever you have a moment, foundationforwomen.org, and the founder of microfinance, Dr. Mohammed Yunus, that I mentioned, it's Grameen Bank, Grameen, Grameen Bank. You can Google them and look at that too. And you've got a great resource in your district. Tracy knows as much about microfinance as anybody on the planet.
Very good.
So bend her ear.
I don't know if I know that much, but I'm happy to help. And as Deborah mentioned, we both served on the Rotarian Action Group for Microcredit years ago together, which is a great resource for Rotary clubs who are looking. And I think that Deborah is going to share this story with them and kind of connect and kind of share more stories. But their role is to help Rotary clubs who are interested in getting involved in microfinance and economic development projects to learn more. And that's what we used to do all the time. You mentioned going to international conferences. I believe Deborah and I have been to a few international conferences together now at this time, the conventions, and we would talk to different Rotarians. And there's lots of action groups around a lot of different topics and lots of different service areas, but that's the one that we've served on. And I believe Dr. Benson serves on the malaria action group, right, Angela?
Yeah.
So there's a lot of those great action groups going on in Rotary, but I'm always happy to answer any questions if I can be of help.
Sure. Yeah, I'm on the water.
Thank you.
The Rotarian.
Okay, yeah.
Yeah. Thank you.
Are there any more questions?
I have a question. The initiative that that you just talked about, Angela, to and Deborah, to collect money for food, that would that be a donation as opposed to a loan?
Yes, exactly so.
Yes.
So on your website, you can, I guess you can specify whether you're giving for food or whether you're giving for money that's going to be loaned out to people.
Yeah, you know, really everything that's coming, any donations coming to the Foundation for Women right now are for our food security campaign. We have a major partnership in Liberia with the World Bank that's given us capital for the microfinance pillar. We have a major partnership with another charity called Edify that has supplied us with capital for the school loan program. We had a major funder who donated money to get this health initiative partnership with Benson Hospital off the ground. Habitat for Humanity, the money's coming through a partnership with them for the housing. So we're focusing on all donations coming to Foundation for Women now, right now, are going to the food security program.
Okay, thank you.
Thank you.
Does anyone else have any questions? Okay, then. Thank you, ladies. And I'm going to attempt to do something else here and see if I'm going to do it right. Okay, Rhonda, and I'm going to stop the recording. Okay, yeah.